it a sensory meltdown or just a tantrum? For children with speech delay, autism, ADHD.
So many of the parents have always asked me the question whether the child is doing all these behavior, whether it's a behavior or it's a sensory meltdown. So here I'm going to be talking about the difference between where a parent can recognize whether it is a behavior the child is exhibiting or it is a sensory meltdown or it's a overwhelming situation that's caused by a sensory issue.
Problem. My child does some behavior. How can I identify if it is a sensory behavior or a tantrum behavior? Solution.
So the first point is the behavior or a tantrum a child is displaying will always be goal oriented. For example, a child he goes to a store and he needs something from the counter. He might kick, throw things, and cry. We cannot control a child, so it is always goal oriented. But if it's a sensory meltdown, a child goes to a supermarket and he sees a lot of lights and voices and crowds, and he's not able to bear the situation. They are not able to process the sensory information, then the child might have a sensory overload. So it is not goal oriented. The child does not need something from the store. He does not need something from a parent. But it's just that the whole overall this ambience, overall the environment, it can be overwhelming for a child. So which is not goal oriented. And the second point is during behavior, the child might wait for your reaction. So he might sit and look at your reaction, whether you're reacting to it, whether you're scolding him or whether you're trying to pamper him. So the second thing is when the child is doing anything and he waits for your reaction to react, for your parent to react, then we know that it is a behavior. But when the child is just crying for no reason, where the child is just screaming for no reason at all, then it is sensory meltdown. And the third thing is a child who's having the tantrum, they might run around and do all sorts of things, but they might do all this running and we cannot which we cannot control. So, but then they will avoid themselves from getting hurt. For example, they might run around in circles. They might look at they cruise inside yours, cruise everywhere, but they are very sure that they should not fall, that they should not hurt themselves. But when the child is experiencing a sensory meltdown, they don't know what they're doing. They don't know that the body is in the space. They run around, they try and get hurt. They might even hit somewhere, and still they might get hurt and continue to hurt themselves. And they're not really in the conscious where they know that the body is getting hurt. And mostly the behavior point of view, the child's tantrum is probably to last 45 minutes and it ends quickly. For example, a child might come to the therapy session. Once the therapy session is over, when they're outside, they might stop crying. But during the meltdown, it can last to days, even to weeks. So there is no proper time that we know that it's going to calm themselves down. In tantrum, the child will calm themselves down when they achieve what they already thought it. So this is one of the way you can relate. If a child is not able to calm, whatever you're going to give the child, if he is not able to calm and it's lasting for a longer time, the child might keep on crying everywhere they go. So that is more of a meltdown. And the next thing is the behavior. The individual is always in control, and during the meltdown, the individual is not in control.